But let's focus on mental health. So, mental health, like teenage mental health, I believe is an epidemic in this country. If you look at the United States, there are things going on here regarding mental health that aren't going on in other countries that are just as developed as us. And that's probably another episode for another time. We're not going to really dig into why that is. We're just going to focus on the mental health here in America for this episode affecting adults. Did you know that anxiety rises in the face of uncertainty? And man, have we come from some uncertain times. Starting in March of 2020 with the lockdowns for the pandemic, that was something none of us, or maybe just a handful, had ever experienced. You had to go back 100 years to the Spanish flu. So if anyone alive today experienced the Spanish flu, they would be 100 years old today, at least. So that was like the definition of uncertain times. And that started in March of 2020. We all know the story. And here we are in December of 2021, a full 21 months since the shutdowns and the lockdowns began. But that really elevated the anxiety and the stress in adults in America. In 2020 alone, according to the Kaiser Family Foundation, 53% of American adults said that their mental health has suffered because of the pandemic. 53%. Now, based on the last census, I believe there are about 260 million adults in America. So 53% based on that survey, 53% of 260 million, or if we just want to be conservative and keep it with some easier numbers, 250. 50% of 250 is 125 million American adults that say that their mental health has suffered since the start of the pandemic. Also, in 2020, according to OptumRx, which is a pharmacy benefit manager, you may have them, you may notice them on your insurance card. But in 2020 alone, antidepressant prescriptions increased 14% after the initial pandemic outbreak. 14%. And in 2020, this is according to the National Council for Behavioral Health. But also in 2020, 54% of behavioral health programs closed those programs because of the pandemic. And 65% had to reschedule or turn away patients. So in 2020, based on that Kaiser Family Foundation, you had 53% of American adults that said their mental health had suffered. And then add on top of that, 54% of the behavioral health programs that are available to help people in their time of need closed their programs. And if they didn't close their programs, then 65% of these behavioral health programs had to reschedule their patients, which is delaying the care that these individuals need, or turn them away completely, which means, again, these people are not getting the help they need. And we're talking about over 125 million American adults that potentially needed help. And if they weren't receiving help, they needed help, whether they reached out for it or not. And I do think that is an issue here in America. Not only are there not enough mental health professionals, whether that is a psychiatrist, a psychologist, a counselor, a life coach, not only are there enough of them to deal with all of the mental health issues like the anxiety, the stress, and other disorders or episodes that take place daily within these hundreds of millions of American adults. But as we see here, the pandemic had a detrimental effect on the availability of the resources that were at one point before the pandemic available. So to me, it's like a head-on collision. You have in one car driving down the highway on the wrong side of the road, you don't have enough resources. And then in the other car driving on the same side of the highway, you have this massive group of American adults that need help. And in this head on collision is the mental health epidemic of America. Now, the CDC, for all it's worth, does have some great resources. I know the CDC, in some circles, myself included, lost some credibility throughout the pandemic. But and that undercuts, I should say, that undercuts the resources that they do have that don't have any kind of politics related to them. But taking the CDC at giving the CDC the benefit of the doubt, I want to list these methods that they have on their website for, quote, coping with stress. The CDC recommends these ways to cope with stress. And tell me if you notice anything about these related to the pandemic. So the CDC says that in order to cope with stress, you could take breaks from watching, reading, or listening to news stories. The CDC also says that you can take care of your body mentally, spiritually, and physically. Also, you can make time to unwind, to de-stress, to relax. Or another way you can cope with stress is to connect with others. And then finally, as one of these coping mechanisms for stress, the CDC recommends to connect with your community or the community within your faith-based organization, like your church or your temple or mosque or whatever religion you practice. But did you notice anything about those coping mechanisms related to the pandemic? They were all taken away or hampered. So the recommendation to take breaks from watching, reading, or listening to the news stories. Well, where did we get our information going on regarding the pandemic? From the news, right? One form of media or another. To figure out what was going on with the pandemic, we had to watch the news. To take care of our body, mentally, physically, spiritually, take care of our body, let's say from from a physical standpoint, gyms closed. So then you had to figure out a way to work out at home, which isn't ideal and is a struggle for some more than most, or for most more than some. Making time to unwind. How are we going to have time to unwind when our lives were turned upside down? If you're used to your children being at school for 6 hours a day and now they're at home, where is that relaxation time that maybe you had carved out in the time your kids were at school? If you were used to going out with friends for maybe an hour, let's say in happy hour, or talking on or doing something like that after work, those places closed down. Restaurants, bars, all closed down for a certain extent of time during the pandemic, and I know that differs based on where you live also. But again, they were taken away or hampered in some way. And then connecting with others. We were told to social distance, and really you should say it's physically distance, because you can be social in outside of being face to face. But anyway, we were told to physically distance at least 6 feet or more. And that makes it a little bit more difficult to connect with others. In addition, we were told when it comes to connecting with your community or your faith-based organization community, churches were closed. And there were lawsuits going about the whole churches being closed. So we were told to physically distance. We were told not to see individuals for a certain length of time. Remember, 2 weeks to slow the spread. And that turned into much more than that. But all of these coping mechanisms listed by the CDC were impacted in some way by the pandemic, and I believe has resulted in the increase, as I just went through those percentages, of anxiety and mental health suffering and antidepressants and behavioral health programs not being available for those who need help. So like I said, a head-on collision, and in the middle, or created from this head-on collision, is the epidemic of adult mental health in America.